My name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Thank you for joining me to learn about autism and how it affects communication. Because people with autism often have communication differences that need support, speech therapy is typically one of the first therapies a doctor will recommend. You may be wondering how speech therapy can help those with autism, especially because each autistic person has unique needs. The good news about speech therapy is that it can be highly individualized to each person. Anyone who begins speech therapy will start with a speech evaluation. The speech-language pathologist, also known as a speech therapist, will assess the person's current communication strengths and where they need support. The evaluation looks at the person's ability to understand language, which is called receptive language. It also looks at their ability to express what they need to say, which is called expressive language. The speech therapist will speak with caregivers and family members to get their input on the person's strengths, needs, and goals they'd like to work toward. Family involvement in speech therapy leads to more success. You can also talk with your speech therapist about how to communicate your child's needs to other family members and important people in their life. Again, the more communication among family members, the better it is for everyone involved. From there, the speech therapist will create goals for the person. As an example, if a person is only communicating with gestures or vocalizations, then the therapist may target the use of signs, simple verbalizations, or words. If a person is communicating using single words and short phrases, the therapist would try to expand that into sentences. Some autistic people may need to use augmentative and alternative communication, also called AAC. AAC offers a way to communicate when someone is unable to express themselves verbally. AAC can include communication devices and systems that use physical pictures, or they can be more high-tech devices such as iPads and dedicated AAC devices that speak for the person. An AAC system serves as the person's voice and their personal form of communication, just as if they were physically producing sounds and words. It's important for people who use AAC to take it with them everywhere so they can communicate in everyday situations. It's also important to note that the use of AAC does not hinder the potential development of verbal language, which is a common myth. In fact, research has shown that using AAC supports subsequent verbal communication for many people, although others may continue to successfully use only AAC for their whole life. Speech therapy can also focus on the more social aspects of communication, called pragmatics. Learning to read facial expressions, show emotions through gestures and facial expressions, maintain social interactions, and ask and answer questions in conversation can be very helpful for those who need support in social pragmatics. Autistic kids will likely need speech therapy for many years, even through the teen years and adulthood. For those diagnosed later in life, they may begin speech therapy as an adult. But no matter a person's age, speech therapy can be beneficial. The speech therapist will work on what's needed at that time to help the person be as successful as possible. For children, speech therapy will likely focus on building early communication skills. These set the stage for higher level language skills as well as social language. Teens with autism may focus on any areas of receptive or expressive language where they need support. Speech therapy may also target social language to help them navigate friendships. Adults in speech therapy may want help targeting social skills as well. Therapy can address skills for job searching and interviewing, as well as problem solving, thought flexibility, and organization for everyday situations. Speech therapy can be life-changing for autistic people as well as their family members. We all long to communicate with each other on some level. It's a necessary part of life. A speech therapist can help autistic people learn to communicate with others in ways that feel authentic for them. And the speech therapist will be sure to involve the family as much as possible. If you or someone you know has autism and could benefit from speech therapy, don't wait. Start looking for the right speech therapist today.